Hello, this is Michael P. Still from Phoenix, Arizona, USA. And this medical e-learning lecture is going to be on stress echocardiography. So this is similar to what the stress testing is. If you looked at lecture 1 on stress testing of the heart, it explained how you walked on the treadmill at different speeds and elevation, and we were able to assess how your heart was doing under those different workload programs. Now, when you add the echocardiography, which is ultrasound of the heart, if you go back to our basic lecture on echocardiography, it explains it's ultrasound of the heart is looking at the chambers and the valves inside the heart by using a high-frequency ultrasound and look at it in two-dimensional echocardiography, three-dimensional echocardiography. But for doing a stress echo, what we want to look at is the wall motion function of the left ventricle to see how well it actually contracts in a workload environment of a stress test. So basically what they do is you lay down on the bed, we do some baseline images, 4 to 6 to 8 images of baseline images of how your heart's doing from several different views. But we do look very carefully at the ones, what is called the apical 4-chamber, apical 2-chamber, and apical 3-chamber views to look at your heart to see how well that pumping chamber is done at rest. Then, once you go on the treadmill and you complete that stress testing component, which can be just a couple minutes, 3 minutes, 6 minutes, 9 minutes, 12 minutes, depending on the shape that you're in and the target heart rate that the doctor's trying to achieve, which is usually a cardiologist present for this examination. And what happens then is once they reach that peak, they run you quickly over to the bed, which is just a few feet away from where the treadmill is. You lay in a left lateral side on your side, what's called left lateral decubitus, and the sonographer will start taking images immediately, looking at the apical views of your heart to see how well the valves or how well the pumping chambers of the heart are squeezing as you go into your recovery phase. So let's say your heart rate was 180 and it goes down to 90 at the end of maybe 6 to 8 minutes post-exercise. They want to get that first 90 seconds of your heart beating very fast. They want to get those images. Now, once they acquire those images, what they're able to do with the software is to actually put them up side by side. So you can look at those images at baseline, what it was looking at, maybe your heart rate was 75 or 80, and then looking at it at maybe 180 beats per minute. So they can compare those two and they can look at the wall motion. There's a way of going in and looking and doing a scoring of the actual segments of the walls inside your left ventricle to determine if all of them are contracting properly or if maybe one is not. Maybe it's a little stunned, maybe it's moving in an opposite direction. So they look at that very, very carefully to see how well your heart responds to that exercise level with stress echocardiography. It's a good test to do. It tells a lot of good information. There can be some small percentage of false positives, false negatives, but it is a very good test. Thank you.